Hello, my name is Dr. Randal Lewis. I'm a physician here at the Men's Health Clinic in Salt Lake City, Utah. The name of our clinic is Wasatch Medical Clinic. I have been working with the clinic for 2.5 years. My experience in medicine has been 31 years practicing family medicine. The last 2.5 years of that have been spent here at Wasatch Medical Clinic. The purpose of this video, as you may have been able to tell from the title, is a discussion on erectile dysfunction and its various treatments, focusing on shockwave therapy. In future videos, I'll be touching on other subjects. Now, during an interview with a patient here in the clinic, I will usually be asked 1 or 2 questions. It's rare that a patient doesn't ask any questions, but sometimes that happens, especially when the patient has done a significant amount of research on this subject. So let's get started talking about erectile dysfunction, its various causes, and the treatments, focusing on acoustic wave therapy. Erectile dysfunction encompasses difficulty getting an erection, firmness of the erection, and the erection not lasting long enough for completion. Now, a patient may experience one or more of these symptoms to different degrees. So I'm going to walk you through our clinic, showing you the entrance, the hallway, an exam room, and the machine that's used for shockwave therapy. This is a Storz Duolith radial machine. This here is the handpiece that's used. Then I'm going to pretend that you are sitting here in my exam room and I am discussing with you the erectile dysfunction and what it is we do here. So the first thing we have you do is fill out a questionnaire. It's 4 pages long. It is asking for your medical history, specifically illnesses or conditions that you have, and it asks for any surgeries that you've had. It asks about medications you're currently taking, and whether or not you're a smoker, and drug allergies. And then I'll go over with the patient the answers to these different questions. The reason we're interested in your medical history and whether or not you're a smoker or have diabetes, those conditions can affect erectile dysfunction and have a bearing on how we approach your treatment. The next page consists of your current erection status. How difficult is it for you to get an erection? Is it hard for you to keep the erection? Is the erection hard enough for penetration? And then it asks how many years have you had these symptoms? And also whether or not you've tried different medications available for treatment. And then there's a portion where I can answer my physical exam findings. And the next page is what's called a SHIM questionnaire, a sexual health inventory for men. It's a series of questions that are a little more specific about your current erections. And by looking at your score, we can tell if you have no ED, mild to moderate ED, or moderate to severe ED, and lastly, severe ED. So I have access to these papers before I enter the exam room. So I'll enter the exam room, introduce myself, welcome you to the clinic, and then I have you answer or qualify the answers that you've put down on the forms. And I start out by explaining that there are basically 4 categories of things that will contribute to erectile dysfunction. The largest category, 95% of the time, it comes down to insufficient blood flow throughout the penis. The other 3 categories are side effects from prescription medicines. The ones I look for specifically are blood pressure medications. There are some blood pressure medications that can contribute to erectile dysfunction. The next category is psychosocial factors, psychological factors. For example, performance anxiety, This is more common in younger men in their 20s and 30s. It can also refer to severe stress or anxiety that the patient is experiencing, whether that comes from his work or family life or even relationships. And the fourth category, it consists of neurological diseases, such as multiple sclerosis. So these four categories encompass the things that will contribute to erectile dysfunction, with the largest being decreased blood flow. So what I mean by decreased blood flow is the arteries in the penis, they wear out. This is due to aging, the effects of aging on the arteries. Then the arteries are not able to perform optimally, and that of course affects the erection. I then mentioned that we have a treatment for this. The treatment that we do is shockwave therapy. And I will ask the patient, well, have you looked into shockwave therapy, done any research on your own? And often they'll say, yes, I've looked at your website. Then I get into exactly what it is. This is a diagram of the device that's used. Now this particular device is about 20 years old. And I mean it was developed and put into use 20 years ago. The orange bars here, they represent pressure waves or concussive waves. And they're different than ordinary sound waves. They are different than an ultrasound. These waves carry energy, and that energy is transferred into whatever tissue is being treated. Now in our clinic, we are treating the penis. So I'll go on and explain to the patient that when this came out 20 years ago, medical scientists did not know what the effect of these waves would be on living tissue. So they did experiments using animals. This was done in a laboratory. For several weeks, they applied this therapy to animal tissue. And they had a pathologist present who would harvest tissue samples every few days and study them. The pathologist learned that the first thing taking place in the treated tissue is microtrauma. 3 or 4 weeks later, they noticed the beginnings of new artery growth. Well, another 3 or 4 weeks go by and they see new arteries. Eventually, they see some new tissue growth. It became obvious that this therapy has a healing effect. The body recognizes the microtrauma and begins the repair process. The first medical specialties to use this therapy in medical practice were physical therapists, wound clinics, orthopedists, and podiatrists, all because of its healing nature. Well, a few years went by, and eventually it was a group of Israeli urologists who came up with the idea that wave therapy might be able to help their patients who have erectile dysfunction. The reasoning behind their thinking was, first, wave therapy had been shown to get new arteries growing in the animal studies where the therapy was applied, new artery growth took place. And second, men with erectile dysfunction, well, they have worn out arteries in the penis. So it made sense to these physicians that if they were to treat the penis with wave therapy, that they would see improved blood flow, which would in turn lead to improved erections. So they set out to prove this theory. They designed a study, recruited men to participate, they carried out their study, and they got good results. They published their findings 11 years ago. They did the study 12 years ago, published it 11 years ago. They began treating patients first in Europe, and eventually this therapy showed up in America. Our clinic here in Salt Lake has been operating for 3.5 years. We were the first in Salt Lake to do wave therapy. It's all we do at this clinic. Our technicians are experienced and they get good results. Now our protocol is for you to have anywhere from 6 to 12 treatments. It's 1 treatment session per week for 6 weeks. It's completely natural and it results in normal erections. Now during the 6 weeks, if you are already taking Viagra or Cialis, you may continue taking those medications, but by the end of treatment, eventually you won't need them. Now I mentioned up to 12 treatments. Some patients, depending on their medical history and the current status of their erections, they may need 12 treatments to achieve good results. I'll usually discuss that with the patient. So then I move on and explain how a treatment is done. Well, you would be lying on the exam table. The technician takes the device, places it here. This is called the perineum. It is the area right behind the scrotum. The base of the penis is right here. The technician treats this area for 5 minutes. Then he moves on to the shaft of the penis for an additional 5 minutes. Altogether, it's 10 minutes of treatment. During the treatment, all you will feel is a mild tingle. Each treatment is done the exact same way. Now, during the 6 weeks, you are encouraged to attempt to have erections. Now, at this point, I'll ask, do you have questions that I can answer? And usually there's one or two questions. Then I explained, well, the next step is for me to do a Doppler ultrasound on your penis to assess the blood flow. And after that, our care coordinator will come and he'll talk to you about the cost of therapy. So a Doppler ultrasound consists of you lowering your pants and undershorts to the top of your thighs and having a seat on the exam table and then lying down. Then I take some ultrasound gel and this device here, and the probe is placed first over the femoral artery so I can listen to the patient's pulse. And then I place it on top of the penis at the base to listen to what's called the dorsal penile artery. And the strength of that pulse correlates with the intensity of the sound coming from the device. And I have a scale 1 to 5 that I use, 1 being very low, 5 being a strong pulse that would be equivalent to the young men that are the technicians here in the clinic. And so I assign the patient a number. Usually it's a 2 or a 3. And I explained that this is consistent with decreased blood flow, which is consistent with the symptoms that you have, with what you have told me. And then again, I ask, are there any additional questions that I can answer? If not, I thank you for coming to the clinic, and Eric will come in and chat with you next. And that's the extent of my time with you here in the clinic. During subsequent visits, you will meet with the technician and not with me. Now at our clinic, one question, a question that comes up often is, what is the role of testosterone? And I tell the patient that, well, testosterone is responsible for your sexual desire, for muscle mass, for energy and mood, but it does not play a role in getting an erection. If you have any of those symptoms, at the Salt Lake Clinic, we will draw a blood sample and measure your testosterone. And if it is low, we give you the first month's testosterone cream to try and see if it makes a difference for you. Let's see. So that's it for this video. Now let me tell you some topics that will be coming up in subsequent videos. You're going to learn about how wave therapy gets new arteries to grow in the penis, the role of testosterone and how it is taken, what premature ejaculation is, how is it treated, the role of nerves in the penis, and how Viagra and Cialis work, along with L-arginine. I'll cover what venous leak is, what Peyronie's syndrome is, and how it is treated. I'll go over what studies have been done on shockwave therapy. I'll cover what our clinic protocol consists of, and I'll compare it to other protocols that are out there being done by other clinics. I'll go over the difference between machines that are used for shockwave therapy. I'll discuss what can be done about your partner's discomfort during intercourse. And I'll cover why do you get an erection at night or in the early morning. And I'll also go over what prostate cancer treatment does to your erections and how we can help it with shockwave therapy. I hope you've enjoyed watching this video. If you would like to contact a clinic near you, please call the number on the screen. It's the number for Wasatch Medical Clinic in Salt Lake City. The operators there can put you in touch with a clinic near you. At this time, we have 24 clinics spread across the U.S., and we are opening approximately 2 clinics every 2 weeks. So again, thanks for watching. Subscribe if you like it. Appreciate your attention.